Hello, Assalamu alaikum, namaste, and good evening to everyone. And I myself, Dr. Dileep Kumar, and I'm President CMT Center of Melon Therapy. And I welcome you all on the behalf of Center of Melon Therapy. And first of all, I would like to thanks our worthy speaker. He is also online, and he's Dr. Santoshnu from, and he thanks to him basically to join us from Bangladesh. He is a clinical physiotherapist at Bangladesh Welfare Society. He's also have multiple certifications. He is certified in Bobath technique. He is certified in CMT. He is certified in COMT, certified orthopedic manual therapy, certified Mulligan therapist also, and have multiple certification in PNF. And he has multiple certifications also, and he is clinical and also involved in some sports. And first of all, I would like to thanks to him especially. We have also worked in collaboration many times, and this is our next webinar. Before we move on, before I request to our worthy speaker, I would like to say that this webinar is going to be purely in English because there is some language barrier. We can't understand the Bengali, which is the primary language of our worthy speaker, and he can't understand the Urdu definitely. So there is some sort of the language barrier, but I will be there, and if the any participant gets some sort of the difficulty, then I will help him and in rather to. And another thing that I would like to say that kindly just like the channel, and if you have any sort of the question, you can ask in the comment box, and we will try to answer from our worthy speaker at the end of this webinar. Again, I would like to say that before now I'm not getting too much time from your side, I would just call to our Dr. Worthy speaker. And secondly, this keep asking the question in the comment box. And what, as you all know, that the today our topic is cupping therapy. We are only going to discuss the types of the cupping therapy. And what is the cupping therapy in our language, we can say this is the hajama, and in Islamic point of view, this is also a sunnah. Okay, what are the types of the cupping therapy, the dry and the wet types of the cupping therapy? He is going to elaborate it clearly more. And I'm just talking about the cupping therapy. So let's welcome to our worthy speaker, Dr. Santoshnu Malik from Bangladesh. He's clinical physiotherapist, also involved in sports, having multiple certification, like as I've already mentioned, in CMT, in COMT, and in also PNF, the Bobath technique. So let's welcome to the Dr. Santoshnu.
Thank you. Thank you, Dr.
Hello, sir.
Dilip. Yes,
Uh,
thank
how's
you.
you, doctor?
Yes.
Sorry, doctor. There's a, I think, interruption from your side. We can't hear you and we can't see you. In fact, uh,
Okay. Can
okay.
I?
There's a little bit voice interruption from your side. Okay. There's an interruption. No doubt. There's uh, a long distance between Pakistan and Bangladesh. So he's going to join us again. So again, yeah, he's here. Hello.
Hello.
Welcome, Dr. Santoshnu, and we have also worked together. So thank you for joining us.
Thank you, sir. Thank you, sir. And thank you, Dr. Dilip. And it's our collaborative program. Like we have already done in from Physio News 24 before. And you are my one of the best friend from Pakistan. And today it's our Independent Day. And I wish you all from our Bangladesh. That is today is the 16th December. It's our Independent Day. And I thank you for the your kind and informative introduction for me. And I will try to share the knowledge about cupping because I have given 2 days lecture on that cupping on that cupping therapy. So I think is only 1 hour is not enough. So today I will going to discuss on the this point of the cupping therapy. Okay, can you hear me properly? Hello, can you hear me? Again, interruption. Yeah, can you hear me? I can't hear you. Maybe some technical issue. Can you hear me now? Okay. Yeah.
Yes,
Now I
doctor,
can hear.
much better.
Okay.
Okay, there are
So
some actually comments are coming that we can't hear you, so that I was just disturbing you again and again. Is my voice
okay.
clear to all of you guys? Can you tell me in the comment box?
Already I can see some comments are already there. We can hear.
I hope there's some sort of the internet issue, so the participants are can't hearing us properly. Now you can hear me. All the guys, can you please tell me in comment box? No
Yes, yes.
audible. They are still commenting. Can you hear the voice of Dr. Santoshnu? Yes, we can hear you. Kainat Sheikh has comment. Okay, now it is over to you. Now voice is clear from your side. So all the guys are requested, if you get any sort of the interruption, then you can tell me in the comment box. Now it's over to you, sir. We are not. I'm not getting your precious time. So it's over to you, sir.
Okay, thank you. And you can share the my first slide. Okay. Thank you, everybody. And I am Dr. Shantonu from Bangladesh, and I am mainly used to give a lecture on cupping therapy. And if any technical error, then please remind me, because I can see your comments and I will try to reconnect again. And the main thing is, today I will discuss the theme of my presentation. Like I have used to give a lecture on cupping in Bangladesh for 2 days or one day, and that was a hands-on. But due to the COVID situation, it's not possible to give that hands-on lecture. So now I will directly going to my presentation. But before that, I will try to give some idea about that history of cupping. And you all know that cupping therapy is I think is a very old method. And some of the previous scientists and the learned person, they used to say that we are learn from the past and we continue our present and we predict the future. But what we have learned from the that's past, that is very important, because we can't predict or we can continue our present without past. And that theory and the knowledge we have learned from our past, that is one of the greatest remedy from the natural remedy, I think. But after that, the invention, modern science invention, that is created some modern equipment for the benefit of that treatment. And that's the old method is cupping therapy, and it is a ancient time of treatment session. And you can say that the Hippocrates, the father of the medicine, he was the inventor of that, and he used to use that cupping method. And then Galen and also some others, Syrian people, they used to use this type of techniques also. But if I say that is before the 1550, before the birth of Christ, there was cupping. And also the nowadays we are just used to know more about the cupping in that is last 2015 or 16, after the Olympic. There is Michael Phelps. He used cupping during his uh, uh, gold medal, gold medal, that is taxation, or what is about during when he has got the 6 or 7 gold medals in swimming. Then we used to make mark, that is what the marks on his body, and then we are going to use that famous, that is a cupping service here. And that time he was used his cup by his physio.
she used to use that cupping therapy for the remedy of his sports performance or any type of injury or enhance his performance. So cupping therapy is it was and is still there in the medical science and it's a very vast knowledge. But today I think it's a very short time in between 1 hour. I will discuss the main thing from there. So first of all, I would like to discuss about. Can you? My voice is not clear. Okay.
Yes, doctor. Should I change the slide?
No, no, you can make the slide little bit large and full screen,
Okay.
and your sound option should be muted. Then yeah, that will be voice will be clear.
Now much better.
Yeah, now much better. Okay, so you can make me full screen. I will show the cup set now on my side. Okay. So in my first slide, I will try to show you the how many types of cup set we available in our practical field during the cupping therapy. I will try to cover more than 80% of cup set that I have collected in different spots. So first of all, I will directly go to my first cup set. That is, I mentioned there, that is a glass cup set. So you can write it down. All participants, you can write it down. There, how many cup set are there? Then I will directly show my presentation. It's cup set. Okay, Dr. Dileep, you can make me in the full screen. Then I can easily show them the cup set. Not the presentation. Yeah, make me. No, 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 not the presentation. You just make me full screen. My slide.
Yes, yes. Okay.
Yeah, I have to show the practical. Okay, so make me full.
Okay. Just give me 1 minute.
Yeah, not the slide. You can open my screen. Yeah, Dr. Dileep.
Doctor, I can't make it because it's a picture basically.
No, 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 not this picture. Just open my screen now. Me, not the screen.
Okay. Okay.
I want to show the practical. Okay, so that's why I want to show the practical. This cup set. You just stop this
Just
screen.
just just wait.
Yeah.
Wait.
So viewers, you can see. Dr. Dileep will help us. No, 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 not this one. Dr. Dileep, make
Yes.
our screen last, my screen. Now, this presentation last, not the share. You stop the share and make my screen last. Yes,
Just wait. Actually, the voice interruption is there. Okay.
yes, yes. Thank you. So, first of all, I have mentioned that is a type of cup set. So, here you can see this is the glass cup set. You can see this is the glass type of cup set. We are used to use this type of cup set, and this is very you can see inside. So lot of countries in the world, they are using this type of cup set. In ancient time also, nowadays they are using this type, and there are different type of shape are there and the diameter. But the main thing is the shape of this dome shape. You can see this the dome shape. So these dome shape are very common in the what is say in the world. Like our God, he likes this shape. Like our head is dome shape, okay, our nose is dome shape, and everything in our body we can find this is okay, this one is dome shape, and also you can find that the shape of the mocks also dome shape, and you can go any other religion, then you can find this dome shape. It's very common in the world. So it's the beauty of the nature, or the beauty of the God, because this dome shape can create some changes. And this dome shape is not full circle, it's half circle. So this half circle, we are creating negative pressure over there. So this negative pressure also, can you hear me? Okay. Yeah, can you hear me? It's okay. So this dome shape, you can see this is dome shape, and this shape is sometimes creating. This is helpful for, we are using this cup set and we are applying the cupping therapy. So I think I will show you the practical before, and then we will go for the another type of cup set is bamboo cup set. So this is bamboo, and here you can find this is the natural process of a special type of bamboo. This is the bamboo cup set we are using for some Ayurvedic, or we can special type of alternative medicine. Through the alternative medicine, we can use this type of cup set, and this is very important for their treatment. And we have another type of cup set is rubber type of cup set. This is rubber, rubber type of cup set is very useful, and it is how you can use this. I can show you later, but I can show you some practical. That is, this is rubber type of cup set. You can just change it and then apply here, and this is very easiest way. Like you can apply it. This is your rubber type of cup set. It's a single punch. Then we can use for silicone cup set. This is the silicone type of cup set. You can see this is the silicone type of cup set. This application process is like that. Here I can use this four shape are there. This is the larger one for the back muscle and the others back soft tissue structure you can use, and then this is the another little bit smaller than, and then this is the another size, and this is the another size. These four sizes are very common. You can find it, but this small size is very useful for facial massage, facial, and for Bell's palsy or any type of facial. For facial region, you can use that type of silicone type of, and very useful. It's a very long-lasting part, so it's you can use for the long duration. And then we have a electromagnetic cup apparatus. We have some electromagnetic means inside. This is the electromagnetic means I have another part, that is, this is the rubber cup set. Okay, so you can hear me, Dr. Dileep. It is okay. You can see this is the rubber type of cup set. Inside there, electromagnetic. There is a electromagnetic there, so its use are same like that. Okay. So I have to change the color because it's not showing properly. Okay, this is the rubber cup set. There inside there is also a squeeze magnet are there. So you have to squeeze that and then also apply it. It's like a electromagnetic cupping apparatus. Then screw on top. Screw on top means there is a screw, this screw, and you can see there how we can apply the cup. You can show this there. This is the cup set. This is the screw, and from the screw you can use that pumping action. Like if it is like here, so I can use myself. If I screw it, you can taking help from others. That is screw. I put that here from here, and then I press it, and then it will come up, and then the pressure will be like that. So this one is screw type. Then pistol-handed bounce cup. That is pistol-handed bounce cups is here the pistol hand. You know this is a cupping apparatus for pistol hand, and then the bulbs are there is here. You can see the cups. These are more common and plastic made cup set. So there is the bulb up there. So here the bulb, and then you open it, and then pistol handed cup. You can use it. Then the pressure will come. I can see this is I can place it here, and then this pistol. Throw the pistol. I will pump it up. Okay. Now the another is a disposable cup set. We can use this cup for single time during that weight cup, or another name is in Arabic term is called hizama. So during the hizama cup set, we can use it for that single time. So that is for disposable cup set. And then another thing is cup with electrical stimulation. Cup with electrical stimulation is like you can see, it's a very common. You know, this is a TENS machine. It's a very cheapest machine in our country because it is China made. So here you can see some electrical cupping set with electrical stimulation. There you can see some this type of machine. There we are using the 2 pads or 4 pads during this cupping session, or during using the TENS. But here the apparatus is, this is the pad. This is the pad for and this is the cup set. You know, so there the place is different. Like it's not like a TENS machine. It's here you can put it here, and then the cup set. From here you can just give the another cap. You can use for cathode and anode. Like 2 ways you can put, and this is the pad for electrical stimulation. So cup set with pad, and very effective during a sports type of injury or soft tissue injury. You can use it for very effective, and very short time you can get the result. I will show you later. Okay, and another is a cup with squeeze rubber. Another part is, this is very common in India subcontinent. There is a local made cup set, so it's used for larger area like chest, or in case of you are giving the respiratory physiotherapy, or cupping, hacking, shaking during the respiratory therapy. So then you can use it for some loosening of the cuff. So it is create negative suction outside the skin. So then you can use for your chest physio. Another is for that's a horn cup. It's a traditional. You can see there is a horn. So this is the horn cup. I will show the use also practically now. So this is the horn cup. So horn cup is more used to, we are used to give use during this ancient time. So a lot of people are used to use that, but it is done by fire. So it's not used normally. We are used by pistol handle or any other things. So you can hear me. It's okay. Now I will like to show you some any other professional set that is different. You can see this is the professional cup set, and this is the very useful one. And if you are used to use, you are interested to use in future, then you can buy it because it's a little bit higher in price. So it's the professional cup set. You can use it in here is the 19 pieces. So you can get the 32 pieces also. So this is purely professional cup set, and you can use it. And another lot of boxes are available in the market. So this is the cup set. You can see a lot of cups in different shape, and there is a 32 pieces, 24 pieces, and sometimes it's 12 pieces, 6 pieces cup sets are available. So, Dr. Dileep, can you change the slide? Yeah, we want to go for next slide. Dr. Dileep, now we want to change the slide. Yeah. Okay, thank you. Yeah, this one. So our main topic is for today is a type of cupping therapy. By this type, we can easily understand what is cupping, because we are used to know that's okay. We have mainly two type of cupping, like we are applying dry, and the method we are applying wet, like we are sucking blood or without sucking blood. But this type is mainly no. I want to the next slide. No, not this one. Another slide. Dr. Dilip, I want another slide. So that's by the type of, yes, this one. So type of cupping therapy is very important. It's the cream of my hands-on technique. That is how we can differentiate the type, different type of cupping. So is you can find more or less is 5 type of cupping in Google or any other places, but I have studied there is a six point I have invented, that is in 2018. That is a
आपके जो क्वेश्चन है वो आप कमेंट बॉक्स में जो है वो पूछ सकते हो, और मे बी देयर इज सम सॉर्ट ऑफ द टेक्निकल इशू फ्रॉम स्पीकर साइड. अगेन ही इज गोइंग टू जॉइन अस सून, so you can ask the questions in your comment box, and at the end of this webinar the Dr. Santoshnu will going to answer to each and every question. कपिंग थेरेपी के ऊपर ये हमारा वेबिनार है, तो अगर आपका कोई भी क्वेश्चन है तो आप पूछ सकते हैं. आई होप डॉक्टर ने बहुत ही अच्छा डिलीवर किया, और कपिंग थेरेपी और उसके टाइप्स के हवाले से आपको जो स्लाइड भी शो हो रही है. आई एम नॉट गोइंग टू डू अ सेशन ऑन कपिंग थेरेपी, ही इज गोइंग टू डू यू, सो ही विल एलेबोरेट यू मोर बेटर rather than myself. He is here again, he is going to join us.
yeah, sorry for the interruption, internet issue. So now I'm audible. Now it's audible
Yes,
now?
doctor, we are hearing you.
Okay, okay, thank you. So this is the main issue, like in during cupping therapy. So that's technical type. We are used to we know there is a dry, wet. Very commonly we are used. So but used to know that. But if in technically you can divide the cupping in four types, like dry, wet, massage, and flush. Dry, when you are using this cup set, this is cupping in plastic cup set, by just pulling that pump, and you are just pulling it, and you can stay for 15 minutes, maximum 15 minutes, minimum is 5 to 15 minutes you can stay there. So this is a stationary cup, or you can move, but that is you are just applying the cup set on your that's on the spot, specific spot, that is regulation therapy. Or you can stimulate the that is another way is the reflexive method. So two method you can go for that, that is one is reflexive, or you can go for regulation. So and if you that is apply that card set for a stationary purpose or any specific point, then you can, okay. Some question is how used to stimulate with cupping, and if any chance of blister formation. That is different issue. Like if you are going to stimulate, like through the cupping, you can that is mechanism of cupping is more than 10. There is 10 reason are behind that. So that is another session. I will try to contact any other classes, but it's a vast session. But today's session I will just discuss on that type of cupping. So blister is formed if you is staying on stationary cup is more than 15 minutes, or it's depend upon the patient. Those patients are elderly, their skin condition is not far to pull that negative pressure and create blister inside that. And also during the session, when you are applying cup, and we will diagnose through the marking of the color of that cupping area. So the through the observing or assessing the cupping area, which are we are applied the cup for 15 minutes, then we can diagnose whether this you are going to go for another session, or weight cupping, or any other, or we should stop cupping or cupping therapy. So for weight cupping, we are using like a skin. Skin we have three layers, and that is epidermis, dermis, and endodermis. Or then especially during everyone, someone afraid of when we are cutting that whole skin or like that. No, we just cut the epidermis, the outer surface of that skin. So it is very I think is take lot of experience to do that, because those who are new, or they are not aware about the good anatomy, then they will cut whole everything. So we are not cutting in skin, just we just stimulate the outer surface, the epidermis, because there is no blood supply. Epidermis, there is some hair follicle and the free nerve ending, but especially the hair follicle and some pore are there. So sometimes we can get any nerve ending also. So there we are giving the passive stimulation. Passive stimulation, like body thinks, okay, we are harming that part, but we are not harmed that much, and we are creating some pore inflammation. But through that suction, we all blood are coming through the blood vessel pore, that is capillary, or some outer layer pores that there are sucked out, and that's washed with the wash materials. So that is we say used to say nitric oxide and uric acid, they are come out. When we are we will going to in details in that Taiba theory or some other theories, which are scientific explanation about the cupping, and then we will find out that what type of substances are coming out, and those all are in practical, and they are going to in lab test, and then we have to found lot of inflammatory substances are there. There is substance V and some sorts of that is secretion. Those are mainly the responsible for chronic inflammation. So a lot of theories are there, and you can, if you go for whole day session or 2 day session, then you can clear about the theory, basic theory. Then you are, if you are using cup for massage region, then that is the massage cupping. And when you are using this cup set for give, and that's cup and then up, cup then up, that means is flash cupping. Then power of suction, then like this, we are using this pistol for creating suction or negative pressure. When you are applying that one pump, 1 to 2 pump, 1 to 2 pump means it's a very light cupping. And then when you are go for more than 2 pump, then these are medium cupping. And then when you are applying is 3 to 4 and more than 5 times, then that will be the strong cupping. And then you can, there is a measurement also. How is measurement is a Pascal law through the pressure, how can you create pressure, that can be measurable. And also that's a pulsatile cupping. Is pulsatile cupping is only you can get the result by that cupping machine. A special device are available in the market, but still we are little bit behind because we don't have such type of cupping apparatus in Bangladesh. But still they are in the market, so you can find out in Google or any others there. So feels any pain? Okay. During giving the cut mark in the skin in epidermis, yeah, if their nerve supply are available, like a free nerve ending are there especially, so then patient can feel some pain, and that's the stimulation. Okay, so I already said, if you see the embryonic theory of cupping, if you try to understand that what is the basics, like some one theory is like embryonic theory. So you can see the embryo, the outer layer of the embryo are represent the skin and nervous system. So when you are become a human and you are putting cup on your skin, it also stimulates the brain and the nervous system. So obviously these cut marks also creates little bit discomfort, but this is the main issue, or this is the uh, main power of your treatment. And this is the main point of our treatment. You create some stimulation through some natural ways, give some cut marks, or this is two many ways we can use the cut marks. Like we can use the seizure for giving the cut marks. Like I can use on. Okay, there is a some surgical blade you can use for there. Okay, this is the that is surgical blade holder. So here you can use the blade, and also you can use some pen. This is also the process of this is called Hizama pen. So this pen, through this pen, you can use this needle. This is almost like a diabetic needle, and you can put it there and use this one for, and then this type of pen can give you some, this is the makes good sound, and then it on hole is there, so it will not damage more than your epidermis. So you can use this type of needle, that is Hizama pen. It's called in common term we can say that is Hizama pen, or weight cupping instrument. Or you can use some surgical blade, and this is the holder, and then you can scratch on there, very little scratch. So for this for pulsatile is only possible through that machine, a special type of cupping machine. And if you if you go to another segment, that is method of suction related type. Method of suction related means how we can create the suction. Okay, how we can create the suction, like, okay, there is a fire. Okay, fire means this, you have to use more than 72% alcohol. You have to soak the cotton with alcohol, and then okay, Dr. Dileep, you can make my slide a little bit larger. Then because already people are used to see this slide, so now I will show the practical.
Okay, sir. Should I stop the screen?
Yeah, you can stop that. I will show them the practical. Okay, I want to change that camera. Okay, now I want to show on patient. Okay, so I have a lot of option for patient. Like this is the process, but I already mentioned that is glass cupping. So this is the glass cupping. You have to soak that cotton with. I want to show the fire cupping option. So cotton with 42% alcohol. Then I have used to flame it, or I have to give fire on there. So this is my fire. Okay. So first of all, I have to wash that part and clean that surface area for the sanitizer purpose, and I have to wash also this cup set also. Then I can use it for negative section. Just put it there and then put it there. Another cup I will show you. This is the flame, and then it is not mandatory to stay long time inside that, but just put it here and then put it here. The another process. So this is a glass cup and using fire method. Now I will show you the bamboo method. This is also like a same way. So here I will go it and then I'll put it there. So it's very easy. But here we can say is another alternative medicine method like Ayurveda and the Bheshaj. So there we can use in another method, but especially we can use it for this way. And another cup set I already told you that is this is the horn cup. So traditionally someone cartier and traditional people are suck it by mouth, but now this is only by this way. So here, good, that, this is cupping. So this patient, if if I use through their, yeah, you can see there. So it will not come out. It is on corner. This is the very easiest way we can pull it out. Or like here, you can find some. If it is more tight, then just press it in the edge of there, then it will out. So through the color, we can diagnose something. We can diagnose something. Okay, so if you can see there, okay. So we will stay there for 5 to 15 minutes according to condition. So their diagnosis should be different, but after 5 minutes we can see some changes in the color. So to observe or to assess the color, then we will decide that we can go for further, or what is the condition underneath the soft tissue, and then we go for further treatment plan, or in future what we can do. But it depend upon the color. Like you can see the color. You can see the color here. So color is quite red and it's not black. So if its color change little bit deeper and deep, is look any changes or any other type of spot, then we'll try to understand that what type of pathology or any other changes is over there. So it's very easy, just push. So this type of cupping are used to use for, we are using for mainly for our that is for our, so this type of cup we are used to use for through the fire. We are using through the fire. Now I will try to make another type of cupping. So that is I already mentioned there, material inside the cup. So if that is herbal cup set, and your herbal cup set means this bamboo cup we are used to use during the herbal session. And then what I say, that is in water inside a pot, we are using the herbal product, and then herbal medicine are boiled up to 30 minutes, and then put this cup set inside there for 5 minutes, and then put it out and wait for 1 minute for a little bit cool down, and then you have to use that cup set, this cup, on the spot for 10 minutes or 15 minutes. Okay, for rheumatoid arthritis, there is a specific there is for rheumatoid arthritis is you know this is a systemic disorder. So application process is not directly on that rheumatism or like that. So in case of symptomatic approaches, you can apply for that. And the issue of cupping the treatment on rheumatoid arthritis, yeah. So directly you will not change any systemic disorder directly. So in case of rheumatoid arthritis, we will go for systemic approaches. So we can apply on some specific localized point, or some specific segmental or regulation method. So we can use for regulation method like localized pain or localized inflammation remedy. And in case of systemic approaches, there is not possible to cure that rheumatoid arthritis, but we will go in indirectly for symptom management. Another is for like ice. If you put ice inside that cup set, then apply that cup set there. Like it is mainly used for acute condition, and that is called ice cupping. If you are using normal hot water, little hot water is not burning water, is just hot water, and put it over the chest, especially for dry coughing or asthmatic condition. So that is very helpful. And nowadays you can see the ozone. Ozone is a special type of detoxification method. So okay, another question is coming, the purpose of different shape of cupping. Okay, that is the nice question. I used to, that cup shape, we are used to see that this length is little bit common among the all over the wall. The shape little bit suction position is common, but this dome shape, you know, this if you see this the miracle of the history or miracle of the invention of God is like the full circle and the half circle. So this is half circle, this one is half circle. So all half circles are connect inside, not like if it is full circle like our earth or like our womb or like our egg, that will give birth. But in case of half circle, like our mouth is half circle, so it will suck it out. So the shape of the different type of cup set is depend on it, sometimes it's depend on that which area you are treating, or which what's your thought, like how many area you are trying to cover. Like large area you need large, small area unit, small type of cup, which that is the diameter, but sometimes you can get some different shape of the cup. This is important for bony area or some projection. So that will be helpful for some area you are pulling out, but it is not smooth, leveled. Then you have to use this different type of shape. So what is the most common method for cupping therapy? Yeah, lot of methods are there already. I have mentioned there is a 10 kinds of theories behind that, and especially we are depending on the time of the cupping and the method of the cupping, and sometimes we are applying inside some materials, like if you are using dry needle inside there and dry needle inside there and then apply the cup. So dry needle have a instant 4 neurotransmitter release. It will release, stimulate 4 neurotransmitter at a time. So when you are applying the cup set, and then there will be a double stimulation. Like cup itself has a stimulation, and then dry needle will work. And if you can use moxa or what, so nowadays in our country moxa is now common. So next time I will show you the moxa, because moxa already is very common in our country, is available. So if you put moxa, is different type of cup, and then cup set, and then on top of this there is a moxa, is like a hot what moxa is, you have to burn it, and then it will create some gases that will warm that surface area, so that will give some hot feelings, and also you can apply that cup. And then already I have shown you there is something is inside that is the magnet, and or also you can apply some magnetic another extra materials inside that, like this is the color, is green, and another option is like a red. So we know that this is material inside. So if you put two cups and this is red and green, like universal cathode color is negative, cathode color is red, and universal other color anode color is red, blue, or green, or something. Not red, sorry, blue, green. Sometimes we can find so different color, but universal cathode color, negative color is red. So when you are using this cupping method for draining the extracellular fluid or some swelling, so then like here you are trying to swelling, try to manage the swelling. So here then you have to put this magnet inside the cup, like here you are applying this cup here, and this is the your positive one. So what we can do, that is this inside your elbow joint, okay? So you will put the positive one just up of that elbow joint, and then put your negative on there. So this negative will create a battery, and this negative will go towards the positive. So it also drain the swelling towards your this here. So lymphatic system will drain it out. So this method we are using normally cup inside material inside the cup, that is a magnetic theory. Also we can magnetic apparatus inside there. So another question is come in which all condition we can use this cupping therapy. This therapy is effective of cupping neurological condition. Yes, sometimes in flaccid type of paralysis we can't use because it will create a negative effect. But yes, we can, for spastic management or some neurological condition specifically, that is the segmental issue. So then we can use cupping therapy. But normally we are using that is regulation therapy. Two method. We are segment means we are following the reflex pathway. So if we are using like I will mention, that is if I use in T1 from prominently left side, then T1 to little bit T3 up to T3. You just mentioned that a T1 to T3 spot in there, but little bit left side, then it will indirectly stimulate the heart. So that is called reflexive way. you are stimulating some systemic systems. Not you directly put the cup over the heart, but you are stimulating the heart through the some specific reflexive point. So that way, but in case of some neurological condition, we will also use some local point that will discuss during that total session, because it will take long time, because some specific points are there. Especially in case of Muslim world, is already they have invented a lot of sunnah point or some specific point for a specific condition. So you can follow that also. There is a lot of apps there, so you can download it and you can find some lot of spotted there. Yeah, you can use that during that cupping therapy. We will find out some dark spot or blood that is red marks there. So after that you can use, but like after cupping, that is not needed any other therapy option, because it's also you have already given the full treatment there for cupping session. So you will just you can make it for the single session. You can try it any other apparatus for the next time also, but better you should use cup therapy along with your all kinds of treatment for drying, like when you are applying the wet cupping, so you need not to give any other kind of treatment. But when you are applying that is dry cupping, and it should be like a your part of therapy, like you are giving massage on patient like 30 for 30 minutes. But when you are applying massage and you are pressurize all tissue underneath it, but when you are applying your cup, that means you are pull all segment out, fascia, muscle, deep fascia, deep muscle, you are all put it, make it free. So natural nutrition and blood will easily come over, easily they will passes through that. So it is cup is the reverse massage method. That means normally you are, when you are giving massage and you are using your energy, your time, you lost everything, like 30 minutes equal to 5 minutes cupping. So which approach you will follow? Like you are very busy as practitioner, so you don't have a lot of time, so you can use cup instead of giving massage. So it's a soft tissue approaches, and you can use it for a myofascial release also. So at the beginning of your session, you can apply the cupping massage, and then you can get the good result and instant result. For any that is reflexive session, if you are applying the specific point, then that is the different. So another thing is area treated related types. That is when you are applying cup underneath your sole, underneath your foot. That is the, we normally say it, okay, it is a reflexology part. But when you are applying the cup and giving some treatment over there, that is called pedicupping. And when you are applying abdomen, cup on abdomen and giving some techniques due to like IBS or constipation or some digestive disorder, then that is the then we are calling that cup is abdominal cupping. Contraction for cupping therapy, I'm not used to get that your question. So can you please clear it again, or you can ask the question a little bit clear? Contraction. Okay. Another is for facial cupping. Like if I can show you some facial cupping, so our PL participant will can they will used to use it, because some direction is there for cupping, like ear, forehead, you will go up, and then upper eyelid you will go this way, and then upper ear, and then this way, and then go this way, this way, this way, and then some use this. So just use this cup, there is a silicone cup, before going to attend any parties or any family program. Then you will can get the instant glue. Okay, you don't need to go to parlor. It's a very nice approaches, and people are those in my country, and those who are my students, especially female students, they used to give this self cupping method. This is Silicone Cup Set, and very useful, and you can get the instant blueness, and that will stay quite long without any other cosmetics. So another thing is for orthopedic. So when we are using that cup set for orthopedic reason, some orthopedic cases, musculoskeletal condition, so that is especially called orthopedic subject. For neurology, I think neurology we have a very limited version of use, but any other session I can show you some in case of some cerebral palsy or hemiplasia, we have a specific point to treat that through the that is dry cupping point. You can regularly use. For wet cupping, we can use in the twice in a month, or specifically we are using in the lunar month, like in every history month in the lunar session we are used to calculate the 17, 19 or 21 every month. Lunar month is very useful for Hizama. Another is for male cupping. Male cupping, I have two types of cup set, and it's a very effective. Like I will show you male cupping. Here is the male cupping, and you can make it more large, and there is some point is there. So male cupping is for penis enlargement, and penis enlargement is when you are using some Ayurvedic or herbal product, herbal medicine for long time sexual intercourse or something like that. When you have some erectile dysfunction or like type of thing, so you can use this natural way, because sometimes we are not used to use this others. We are used to use that herbal product for some kind of sexual issue, but here the penis male cupping, we can use this cupping set for long time satisfaction, and you can practice it if it is available in your country, and then you can use it, and then you can instantly get the result. Another set is for female cupping. So female cupping is a big issue, like those female are try to reshape or try to enlarge their breast size, then they can use that cup set. This is the small one, and that is very important thing is female age should be below 20, and sometimes we can use this last version of cup set, and you can get is the female cup set, so it can reshape your breast. So it is very famous for they're fond of female therapists or female patient. They can use it very much. And other type of cupping in case of sports. In case of sports, uh, uh, if you are using this cup set in case of sports during a sports, then you can name it like a sports cupping, like a Michael Phelps during a swimming competition in Olympic. He has used a lot of cupping for his regeneration. And then we are physio, and we are used to use in hydrotherapy. So inside of hydrotherapy pool, you can give the cup inside your water, or you put the cup in your body and then you submerge your body inside the water. So then you can get the double benefit, like cup will suck and the buoys will pull it out. So double benefit, that's called aquatherapy. And for some there's cellulitis, or some when sometimes skin are a little bit cracked or some scar mark there. So when you are using that cup for remodeling or reshaping or change the skin or improve the cellulitis or remove the cellulitis cell or make the easy look little bit glossy or make yourself a little bit fit or brighten, then you can use that cup set for massage, and that is different technique. So that is called cosmetic cupping. So today is a very short time already. I have completed, but some technical issues there. So I think maybe any next time we can go for further or whole day program. So thank you, Dr. Dileep. I think is enough for today. So we can go for any other session. Hello, Dr. Dileep. Can you hear me? Participant, you can hear me? It's clear? So I think it's a like a cupping therapy due to lack of research or lack of knowledge. We are not maintaining the proper standard now. So a lot of people, those who are not a medical person, they are used to practice it by the name of our prophet Muhammad Sallallahu Alaihi Wasallam. So it's a, I think it's a curse or a sin. Don't do that, because if you are not a medical person, then you have no right to treat human. So it's not you are just spoiling the name of Muhammad, Prophet Muhammad. So it's a nice treatment, and it's a very sensitive issue. Like when Prophet Muhammad went to Miraj, and he has announced the voice from the others Nabi. There is your ummah should practice this cupping on earth. So this word is very important. I used to say on my students, that is, you are the medical person. Without any medical certification, you can't practice cupping, wet cupping or dry cupping, because without medical knowledge you can't practice. So all physios, you have to keep in mind that if you are not knowledge, get the background or proper knowledge of cupping, don't do practice, and not encourage others religious person to do that. Okay, how long that cupping mark will vanish? Like, this is a very common question. So it will can stay for more than 2 weeks. But when you are regularly cupped, like dry cup every day, you are practicing on your practice and giving every day, so it will not naturally vanish. But if like on chest or on, especially we are use that cup set on backside. So backside it will those patients are smoker. They have got a very black mark there. So that will take little bit time, but otherwise it will go on more within 2 weeks. 2 weeks. So any other question? Dr. Dileep, we can end now. Yes. So anybody have a specific question, then we can go for that.
Yes, sir. Though no doubt, although it was a very wonderful session, it has been definitely. I had actually no grip over the types of the cupping therapy that are especially used in Pakistan, basically. Or here are only few centers they are practicing, but normally the normal method is used, a simple cup that is used. But no doubt you have elaborate a very wonderful regarding the types of the cupping therapy, and we just have this knowledge, but thoroughly we have seen it practically. So thank you so much. Now let's move on to the questions from the participant if they have. Otherwise the knowledge you have delivered, I don't think so any participant must have any sort of the question that is need to be answered still. But after that, let's see how the participants are asking. So all the participants, they are requested, our speaker is here, so kindly ask the question in comment box if you have any sort of regarding the cupping and regarding the types of. All the participants, thanks for coming. And let's see, sir, what are the questions that have been remnant yet.
Already I have given some answer of that question, but any
okay, one of the comment is there. Yeah, they have you have answered all the questions actually. Furthermore, let's see. So thank you so much, sir, for joining us, and it was very great, wonderful. No doubt we are also seeking for a future a practical a workshop, hands-on workshop on the cupping therapy, and definitely we will contact with you. So let's see in future. There's a small question, sir. here is displayed on the screen.
Okay, that is for special question is for wet version, like how we can do that. Okay, there is a two method in wet version. That is single. You put the cup and wait for 15 minutes. That is called single S on S. If you are put the cup and then cut and suck the blood, that is two times. That is 2S. But in hizama, that is 3S. That is 3S means first you have to put the cup for 5 minutes, then observe the underneath structure, then cut the structure, epidermis, then put the cup, then blood will come out, then wait for 5 minutes, and then when you can see there's the level and there's plasma layer you can observe, then you will just put it out. That is more or less 5 minutes, and then wash the blood, and then again you put there. So that time you can see some nitric oxide and uric acid will come. So that is 3S. And in case of dry cupping, it's if you are using that stationary cup, that you can stay maximum 15 minutes, but not less than 5 minutes, and you can move that one or you can put it there stationary. That is the different, but method of applying that stationary cup is fire, or you can pull, or you can electrically pull. That is the difference. Like I can show you something. Nowadays you can find some materials. That is, this gun is manual. This gun is totally manual, but this is the mechanical. Yeah, that is electrical. So here you can apply that electrical cable there, and then it is automatically sucked it out. So this is the difference. When you are becoming older, then you will use this one. But now you are energetic, then you can use this one. This is the difference. Any other question? Yeah, another question is for anxiety and depression. Yeah, for anxiety and depression, there is some specific point over in frontal space, but that should be more careful, because when you are applying the scarf here, then your mood will change, your emotion will alter. So that method is different, and a specific point you have to follow. Any other question? Because Dr. Dileep, that is the in Muslim world, the proper dose, session time, and the specific point all are maintained in Muslim world, like this Arabic country, this subcontinent. But this method is invented from in Upanishad, in ancient time in this subcontinent. But now after that, China, China, they have stolen all resources. So they created a lot of things like dry needle, acupuncture, everything. But still, during the Prophet Muhammad, he used to get that knowledge from also in China. But he also, this method, he was tried to spread out among his ummah or his followers, because it is a very nice and safe approaches. And during that time, during that ancient time, this is the surgery. Normal hospital base, this is the surgery. Nowadays, there is a lot of processes there, but in the people, those who are riches or the king and his family, they are follow this method.
No doubt. And another thing I also wanted to edit, that if you talk about the Islamic point of view, there was a simple cupping therapy that was called as a hajama. But these the types, they are launched especially by the West. Now, as you take the name, as you told that the China has no doubt taken all the resources, like the acupressure, acupuncture. I am also being an acupuncturist, I can say the concept is beyond the same, just to improve the proper channels of the body, just to improve, utilize, or to make balance the different energy resources, like the concept of the acupuncture we use. So the types of the cupping therapy are launched, are invented, are initiated by the West techniques, like the different countries are using it, as you said, the Islamic countries. But the basically hajama was a simple concept of the cupping therapy that was just used to purify the blood. That thing I wanted to edit. And no doubt you are very right, the types of the cupping therapy are launched by the different as you know, as you also mentioned some names. Okay, so overall the webinar is very has been very outstanding, and let's now I don't think so we should wait for the participant. All the questions are very well answered. So I once again I thanks to you. We have also worked collaboration, and I also thanks to you and respect your knowledge from the behalf of the public of Pakistan, and also from the behalf of the being the president of CMT. Now just we are sir waiting for your last words from your platform and from on the behalf of your topic, and then we will wind up the webinar.
So thank you, Dr. Dileep, and especially from my side, today is our Independent Day, and everybody I will wish. And it's a collaborative program. Like already I have invited Dr. Dileep. So it's my time, so that's why. But it will continue. It's the beginning. So our knowledge sharing process will continue, because in my side already Physio News 24, I am little bit busy with some other works with Dr. Palsy sir. So that's why I'm not used to come. So next time we'll go again and we'll collaborate the program. So thanks all participants, and thanks for having patient, and they are politely or effortlessly they are try to understand. I think next time I will share all elaborative approaches. Okay. Thank
Okay,
you.
Dr. Santhu, one thing before we leave the studio, basically, I wanted to say that actually I was taking your time on another day. Just reason is beyond that, because today, no doubt, it's the Independence Day, and I wanted to wish you as well. So I actually I didn't wanted to disturb you, because it's a day of celebration and everyone
No,
has a
no, no.
busy schedule. So on the behalf of your Independence Day, and after that, instead of this, you gave us time. That's really appreciating and honored for me to just wanted to thanks for that, special thanks for that.
Thank you. Thank you. Thank you.
Thank you, sir. Thank you so much.
Thank you.
Okay, thank you all the participants for joining us, and no doubt the webinar was very fantastic and no doubt very informative, and I especially thanks. I have worked with Dr. Santoshnu last time in a international webinar as well, but this time he has contributed and he's full of the knowledge, because last time the India is also involved between us. The whole the webinar was from the India, Bangladesh and Pakistan, and from the Bangladesh perspective that was organized by the Dr. Santoshnu, and I really thanks to him, so that he gave us time from a busy schedule. And I am also expecting to have such hands-on workshop on cupping therapy, and in future, hopefully in future, let's this COVID situation subside, we will invite and we will have a hands-on practical session on the different types of the cupping therapy. तो अगेन मैं बहुत ही शुक्रगुजार हूं, और मैं सबको थैंक्सफुल सबका थैंक्स कहना चाहूंगा। और सेकंडली एक और क्रेडिट जाता है मैनेजमेंट का, वो जाता है डॉक्टर जैनब और हमारी टीम को, सीएमटी के चैप्टर सीएमटी साइवाल चैप्टर से हैं, तो डॉक्टर जैनब अफजल और उनकी पूरी टीम का भी मैं जो है वो बहुत शुक्रगुजार हूँ, जिन्होंने ये सारा मैनेजमेंट संभाला। और उसके अलावा भी हमारी जितनी भी सीएमटी के चैप्टर्स हैं, ऑल द एम्बेसडर्स एंड देयर टीम्स, आई एम वेरी थैंकफुल and I literally feel myself happy to have such team members. And although they basically do very activity instead of my busy schedule, they are working very well. So I must appreciate their efforts. And again, all the participants, if you like this webinar, then please put your feedback on our CMT FB page and stay updated, stay connected with the CMT. We are going to teach you every subject. And again मेरी एक और मैनुअल थेरेपी के ऊपर सीरीज भी आ रही है, जिसके ऊपर एक छोटा सा सेशन भी होगा, एंड इट्स प्योरली प्रैक्टिकल एंड फिजिकल। सो अगर फिर भी कोई कपिंग थेरेपी से रिलेटेड अगर आपका कोई क्वेश्चन है, आई एम हेयर टू आंसर यू। अदरवाइज वी आर गोइंग टू ओवर दिस, एंड वी आर would like to call the Dr. Zainab Afzal also, and she is ambassador from CMT chapter from Ramyar Khan, and we are here waiting for her. Okay, किसी का अगर कोई क्वेश्चन है तो he or she can ask. Okay, I hope all the questions they are very clear. Dr. Zainab Afzal is here. Assalamualaikum. We can't hear you, Dr. Zainab. Can you unmute your mic? Sorry, Zainab. We can't hear you properly. It's we can't hear you still. Can you hear me? आप सुन सकते हो मुझे? Okay, I think there is a voice interruption from there's a mic issue from her side. From okay, she's doing the setting. आप ऐसा करें डॉक्टर जैनब, अगेन हमें ज्वाइन करें, आप लिंक को जो है फिर से ज्वाइन करें, मे बी देयर इज इंटरनेट इशू. Thanks to all the participants, and as far as certificates are concerned, you need to contact with the Dr. Zainab Afzal, and you need to join our WhatsApp group, and CMT different subjects or different webinars जो है हम international और national जो है वो कराते रहते हैं. So if you have any sort of the query, you can ask via the platform of our YouTube channel. We have a CMT FB page. You can directly contact to me. And as far as one question was concerned from Dr. Hira, and she was asking the female hajama practitioner in Lahore, so I will recommend her definitely. Assalamu alaikum. Okay, there is still a voice interruption from Dr. Zainab. Maybe there is an internet issue. Okay, no voice, we can't hear you, Dr. Zainab. Okay, leave. Don't worry. We are just here to thanks to you for your actually management. She is CMT ambassador from Raim Khan chapter, and she and her team basically they all manage this webinar and all collaborated. So thanks to her, and thank you so much, Dr. Zainab. We can't hear you. We wanted to listen you, but unfortunately, so thank you so much for joining. Thank you. Bye. Okay, guys, it's time to wind up the webinar. So keep watching Center of Manual Therapy, and we are going to entertain you with all the physiotherapy subjects and physiotherapy topics. So stay updated with the CMT. Put your remarks, put your feedbacks on CMT FB page. So no doubt we are going to see you in another webinar, in another session, in another topic with different topics regarding the physical therapy field. Stay home, stay blessed, and once again thanks to Dr. Shantoshnu for joining us. And stay home, stay blessed. Keep watching Center of Manual Therapy. Okay, goodbye. Allah Hafiz.